Hey everybody, my name is Hari Iyer. I am here for this edition of Ask the Experts with AMA. I am the Government Relations Advocacy Fellow, or GRAF, here in Washington, D.C. with the AMA's Advocacy Office, and I am here today to answer some of the fantastic questions that we've received. And the first question that I want to start out with is a question from Melissa asking, what does GRAF stand for and what does the role entail? So again, GRAF stands for Government Relations and Advocacy Fellow. And the role really is pretty multifactorial, which is one of the most exciting parts about it. There are two halves, is the way that I would overall put it. The one half is working in policy and working in advocacy. And because there is so much going on in the space of policy and advocacy in healthcare, a lot of what I'm doing is learning, collecting information, going to events all around the Hill, whether they are congressional briefings or whether they are think tank events, and reporting back and helping people around the office while getting a solid grasp of some of the main issues affecting patients and physicians right now and today. And a lot of those issues, too, can be specific to medical students. So I'm always happy to be able to provide that unique perspective as well. And then the other half is a little bit more external facing. It's where, as the student who's working in the AMA's policy shop, I get to go to different schools and I get to talk to different students in all sorts of settings. And that can be anything from a lunch, a dinner, a coffee, or an event that the school hosts. And importantly, one thing you learn from being a medical student and visiting medical schools is food is an incredible motivator for students. So we get some food together and get to talk a little bit about what it means for a student to be involved in AMA. And I get to be the messenger and talk about how you can, even in medical school, make your experience really meaningful, however that works out for you as an individual, and then talk again about some of those projects that are actively going on the Hill and otherwise that, when you're bogged down and studying hard, it can be hard to keep up with. And I get to kind of advertise also that, as a part of this organization, you're a part of a network where you meet students from all over the country who are interested in similar things to you and who have different expertise from you, but who could also learn a lot from you as an individual. And we have this great network on social media and otherwise, and committees where we can share our expertise and grow as advocates. So that's basically what I get to facilitate and what I get to do. And it's been a really exciting process so far. And the next question, actually, that kind of stems well from there is, what is the best part about being AMAcraft? And that honestly is a pretty hard question. I think the best part really is being able to engage with students who are trying to find exactly what their path forward in advocacy is. Because again, when you're so busy in medical school, it can be hard to keep up with the three or four major policy happenings that might occur in a week that actually do affect patients. And when people learn about those things and are wondering what their next step is, like let's say we're at a dinner and somebody says they're interested in women's health, and I can say, hey, the AMA has been working on this Title X issue for a while, and it's something that is affecting care for 4 million low-income people, primarily women, and hurts their ability to get things ranging from HIV screening to STD screening, mammograms, pap smears, reproductive health care. That's something that is really exciting for a student to learn about, and more importantly, learn that it's something that they can do something about, and that coming to an AMA meeting, they're able to push forward ideas that can lead to our action as an organization, as a massive organization that really pushes that issue forward. And I've been able to see that so many times, but also just the sheer amount of expertise. I would say this is my other favorite thing. The sheer amount of expertise that's concentrated not only in this office in DC with all the great AMA staff, but also in the city of DC, where people are streaming through and talking about what they're doing to transform healthcare, is really staggering. And I've learned so much even from just going to different folks' offices and working on projects with them, and at different events, going and talking to the Secretary of Health of different states, different members of Congress, different people who are experts in their various fields of anything ranging from health IT to infectious disease. And a lot of these leaders who are pushing the charge for some of these issues are physicians too, which is really inspiring. And the people who are in this office are incredibly dedicated to making sure that all of our ideas that we work so hard and spend so much time passing in our deliberative process are addressed in a meaningful way. And another question that we have received is, what is the most challenging part of being graph? And I think moving to DC and being interested in policy, everything is a shiny object. And I think that's like the best thing ever, but it's also kind of rough because there's so much to work on and there's so much to learn. It's just like in medical school too, when you're studying for a test and you kind of find a topic that's interesting within that. Like let's say you're studying for an infectious disease test and you're really interested in HIV and the social issues revolving around HIV and the effort to reduce HIV transmission by, I believe, 90% in 10 years. And you're like, I want to read about this. I want to read all about the different medications. But you have a test coming up, and you only have a limited amount of time to engage. And that can be hard because you have to really make hard decisions on what to spend your time on. But you do get, just like in medical school, again, exposed to so many things, which is also really powerful. So when it comes down the pike, when you have a little bit of extra time, you can follow up on these really fascinating interests and dive in. So I would say the hardest part really is deciding in a given day, what am I going to sacrifice? Because there's so many cool things you're going to gain, but what are those maybe one or two things that you got to say, I'm taking the L on this. I can't fit it into my schedule, and that's okay. And I've learned this much already about any number of other topics. And as far as our next question, which is, what is a typical day in the life for the graph? That definitely also is something that varies because, again, when I'm doing that half of my job that involves visiting schools, it's a lot of travel. And when I'm doing that travel, I can do some work from afar, getting on my computer and doing some of the research that helps to support people in this office and, studying on the different issues that we're facing. And maybe even the events that are going on around the Hill, I can live stream into. But for those also in preparing and trying to look into what the different efforts that are going on at the individual schools are, what their curriculum looks like, how they have been involved in the AMA in the past, I try to prepare myself along these lines so that when I get there, I can not only talk to them about the issues that matter, but in a way that's reflective of what it's like to be an AMA member at their school and what the also local, regional, state level public health and medical, health policy issues are at their communities. So, when I come to schools and if I were to talk only about the things that are happening at the highest levels, med students might say, hey, that's hard for me to access right now in a real way while I'm where I am, while I haven't engaged too much in this just yet. But locally, especially with the strong group of, community that's interested in some of these public health advocacy issues. So that might be anything from how can we make sure we're having a naloxone training in our local community to fight the opioid epidemic? How do we volunteer at a syringe exchange program? How can we there was a school I visited in Georgia actually where they had students recently start a cooperation with, I believe, a homeless shelter where they did foot care to make sure that people had clean feet to avoid wounds or maybe infections that could lead to downstream consequences. And in a school in Texas, they are partnering with their state medical society to provide helmets for kids. And it really can be anything that you kind of put your energy to and are able to engage with that can be really fulfilling. So it's really variable also the things that you get to see at the local levels that people might be inspired by when I'm able to share between schools. And when I'm actually in town, again, I get to do a decent amount of reading on policy. So morning newsletters are a really big thing that I like to engage with. And then visiting different folks who are even in this office and asking them what they're working on and seeing, hey, how can I be helpful? So there are a lot of similarities actually to, again, medical school when you're on the clinics. You have to find out what you're interested in and see how you can pursue it. So we have projects going on in AI. We have projects going on in maternal mortality. We have projects going on LGBT issues. We have projects going on in access to care. And these are all things that you can dive either deeply into or do kind of more at a surface level. And depending on which project in particular appeals to you, you can say, hey, I'm going to do a deep dive and provide you with all this information on this topic and learn so much about it in the process, and make that a part of a really important part of your job. So with maternal mortality, for example, I got to do research into the field where I was learning that the maternal mortality rate for Black women is 3.5 times that for white women. That over the last decade or so, in the U.S. as opposed to comparable rich countries, our maternal mortality rates are going way up. And then I get to see how AMA actualizes these things. So when Dr. Patrice Harris, our AMA president, gets to go before Congress and talk about what the AMA is doing and what the AMA thinks about the issues with maternal mortality, how we can fill coverage gaps, how we can make sure we're studying those lapses that lead to those disparities and the inadequate care that really is being provided to mothers. And then when she's able to bring our AMA's perspective, when she did, I believe last month or 2 months ago, before the Black Maternal Health Caucus, talking about, what are the solutions to those disparities in particular, and what can we do to address some of these social determinants of health and structural issues in the way people get health care. And you have other issues in LGBT kind of affairs, where you have these conscience rules that are being pushed forward that say, if anybody along the line where you're going into the clinic to getting your care holds bigoted views about LGBT folks, then they can say, hey, I don't want to provide any service to you. And what does that do for an already vulnerable, medically vulnerable population that has had historic disparities in care when they're trying to seek necessary care? It discourages it, and it really compromises healthcare in the country. And then there are issues also that AMA is taking a really strong stance on, like immigration and the public charge rule that says, if a legal immigrant in the United States seeks basic benefits, and that can be anything from food stamps to keep food on the table, or housing vouchers to have a home for your family, then when they apply for a green card, they're going to be or even Medicaid or prescription drug vouchers for Part D of Medicare, then they aren't going to be able to get their green cards. They're going to be deprioritized for green cards, basically. And when we have hundreds of cases of, or even I believe over 1,000 cases of measles, that are going on, and just recently we were able to keep our measles elimination status. Vaccinations and being able to access basic care like that are so important, and making sure we don't undermine communities' abilities to get healthcare is critical. And I guess using that to transition to what we're actually doing as medical students, we have a really interesting initiative called National Advocacy Week, where we're deciding, hey, we're going to take on 3 issues, and we're going to do it in a way that people all over the country who are in medical school, who are busy folks, can find their way in. And the 3 topics we've selected are firearm violence, graduate medical education. So that's the holy grail for medical school, where in the end of it, you want to end up in residency training to actually become a doctor who's able to provide care to real people. And then the 3rd issue is prescription drug pricing. And each of these, in their own unique ways, are really just ubiquitous. They're so wide-ranging in their impact on patients' ability to get healthcare and to be healthy people, right? If firearm violence is killing 40,000 Americans a year, and it disproportionately affects certain groups of people, and we have consensus on a lot of the ways we can move forward. And the folks who are seeing these things on the back end, when people are victims of firearm violence, whether it's suicide or homicide even, physicians are seeing that in the front lines in hospitals, and we're able to take a stand, and we have, and we're doing that in Congress, and medical students all over the country on National Advocacy Week from October 28th to November 1st are going to be taking that stand, and locally, where it's most impactful, frankly, sometimes. They're going to be meeting with their legislators and their legislator staffs and saying, here's the evidence, and here are basic solutions that we can agree on that are able to decrease the burden of firearm violence in our communities, and let's do something about it. And then you talk about graduate medical education, where over 6,000 people, medical students who are applying to residency, end up unmatched, and how scary that is, because you have all of this debt, and you're going through all of this and dedicating so much of your time in your life, because that end outcome is actually being able to practice and help people. And an impediment to that is actually legislation that was passed in 1997 that says that hospitals have to cap their amount of residency spots they can offer, and that makes it so that when medical schools grow, the spots that you're supposed to fill after medical school to actually become a doctor can't grow as fast. And we have to do something about that, because you hear about rural communities, and you hear about people not having access to care, and the long commutes that people sometimes have, and you want to do something about that as a medical student and as somebody who's going to be in the profession. And the AMA takes on these challenges very seriously. And again, on National Advocacy Week, we have a series of events and advocacy asks on how to concretely ask our legislators to take action to solve some of these issues. And then our last issue is prescription drug pricing. This one's easy. Every single one of us has a family member, personal experience, or a friend who has gone to some sort of clinic or medical appointment, or any grandparent where they need a medication, and it might be way more expensive than they thought, and that might prevent them from being able to take that medicine and live that quality of life that they could if they were able to. And increasing transparency in what the heck is going on when drug manufacturers, insurance companies, pharmacy benefit managers are laying out how we purchase drugs, is really important to make sure that it makes sense and it's affordable for people. And that's something that we as medical students are taking forward to legislators' offices again, and locally at our schools, because it's also so important to educate our peers on some of these things so they can engage as well. Our power is really in numbers. And while the AMA is doing all of this great work up here, if it's not for everybody out at the different medical schools working hard, and at the residency programs at the hospitals, and physicians who are all over taking on these tasks locally, we lose a lot of momentum, and that momentum can be so powerful. And our next question, actually, or before we move on, the hashtag for that advocacy week that we're hosting, that's going to culminate with those legislative visits locally, is going to be hashtag MSS Advocacy Week. And I really hope that as we get closer on Instagram, Facebook, Twitter, that we can have as many of you folks out there as possible engage in conversations on these issues and talk about those advocacy asks that we're fighting for, and share the events that our medical students across the country are going to be putting on, because it's going to be really exciting and a great way to push the needle on key issues that we've been fighting for a long time. Our next question is, what has been the most interesting intersection you've found where the work of our AMA and its policy solutions directly impact patient care? And I think that that's been in these issues that talk about certain populations of people that are being targeted by policy. So again, that's Title 10, where women's access to reproductive health services and screenings is being compromised. In the LGBT issue, where people would have these quote unquote conscience rights to neglect giving care to people, but also in talking about how do we make sure that patients who are all over the country who are suffering from opioid use are able to access medication-assisted treatment. That's a huge one. And the AMA has been at the front lines working with the various states to make sure that insurance companies that are putting up barriers for people who are vulnerable and stigmatized seeking care to get that gold standard of treatment, MAT, medication-assisted treatment, for opioid use disorder, to make sure that they can go ahead and get that, so they can come back to recovery and be able to repair relationships with their families, their communities, and heal, and not end up a tragic fatality at the hands of the opioid epidemic. That's been something that's really key. And also even looking more so the AMA has supported legislation on maternal mortality that would, for example, make sure that the states have better mechanisms of studying maternal mortality, and that affects patients, because a lot of people that I've met have stories of people they've known, mothers that they've known, Black mothers in particular that they've known, where there have been really scary close calls in birth. That's something that is a really big part of people's lives, and you don't necessarily expect to be this scary thing where all of these gaps in care are happening, and we're taking that on. And also just in being able to maintain patient privacy and make sure that equity is maintained as we look at the future and how we're going to be sharing data, and how we're going to be pushing for AI, augmented intelligence, to make clinicians better rather than to make patients worse off, or make the inequities in our system go even further and propagate into the future. And these are things that we're addressing, early on and robustly, again, with our really incredible experts that I've been able to learn so much from here. And these are all the kind of cutting edge talks in policy too. And the AMA is right there at the table, and it's been really fantastic that our opinion is so valued. And then the other thing is vaping. We've seen all the news about vaping and how the AMA has been a group to take a stand and to advise people about the harms of nicotine and the harms of youth use of nicotine and working with various states to get out there about these things. And then in graduate medical education, when it comes to patient care in Philadelphia, there was a hospital called Hahnemann University Hospital that closed, and I believe over 500 residents. Some of these are people who had just signed their leases maybe a week ago, had been displaced. And now, through the work of their state medical society and other groups, as well as AMA, they have had the ability to find different residency spots and not have this outcome where they aren't able to serve the most underserved patients in Philly, and hopefully get closer to making sure that those people who now might not have a hospital close by are still cared for in some way. And these are battles, again, that the AMA is taking on. It's really amazing. And in primary care, for example, I went to Colorado for to a meeting with some of the schools, and one of the primary care docs who happened to be there was talking about the public charge rule, again, with immigration, how immigrants, again, these can be legal immigrants who are feeling afraid of getting care that they need because of the rhetoric that's going on, the stringent policies that are really discouraging communities from seeking what they need to be healthy. And when our communities aren't getting the care they need to be healthy, we all are suffering. That's one of the tenets of public health. And our next question to transition as well is what advice would I give to those interested in becoming a government relations advocacy fellow in the future? And I think the number one thing is developing mentors. And how do you do that? That's like the eternal question, the perennial question in medical school. How do I get this mentor to tell me, what specialty, if I'm a good fit for this specialty, or if I can work on this issue that I care about? How can I find people to support me and help me to grow in this field? And I found that the number one way to do that is by attending meetings. And different states, fortunately, and it's kind of unfortunate too, where some states are still working on this. Some states have the ability to actually fund their medical students to go to meetings. And these are meetings that are happening at the national level with AMA, for example, where in November, this coming November, the 14th through 16th, medical students have our meeting in San Diego. So if you're nearby, we would love to have you. And in March, I believe March 5th through 7th, we're going to be having our conference as medical students in DC, where instead of having an intermediary to your advocacy, we're going to educate you on the major issues that are happening and have you go to your representative's office or senator's office and talk to them or their staff about key issues and be the direct advocate. And then in June, again, we have another meeting where you're going to be able to come to Chicago and talk to different students and clinicians about what it is that they're working on and passionate about in public health, in patient care, in making sure that the future of being a physician is a good one and is unencumbered by things like burnout. Engaging in these conversations. And again, at your state level, you're going to be able to meet so many passionate physicians. So I would say, go ahead and start asking about how can I make these meetings? How can I work with my curricular, staff to make sure I can get a couple days off to meet these doctors and these other medical students who are going to change my life? Because that's what happened to me. I went to my first meeting in Ohio, the student section meeting. I met somebody who before medical school had worked in policy. This person gave me, access to a lot of newsletters. They just kind of told me how to learn more. And then other students said, hey, I've gotten to know you a little bit. Here's how in the medical student section, you can get more engaged with not only what you're interested in, but other people who know a lot about that same, group of things. And when, the issues you're interested in might be anything from health equity, which is really a hot topic right now and the AMA is taking very seriously, or, access to care. Meeting these other like-minded people is a really powerful way to be able to grow in your advocacy. And the other thing that I kind of touched on already is starting to read newsletters and starting to learn more about health policy and see it broadly, so that when you kind of find those few things, that narrowly interest you, you can attach to those things. Because otherwise, if you don't read some of these newsletters, you might not see what's going on to pick up on, hey, this is what I'm interested in. And the other thing is, at your institution, medical schools have a lot of challenges headed into the future of making sure that our medical education system works for the kinds of issues that we're going to face tomorrow. So understanding health systems, making sure that we are able to provide those social determinants, the care that's sensitive to folks' social determinants of health and their ability to access food and medications and all of these things. And when you're at your institution and you think about some of what's going on from this policy lens and how you can do something about it or how you can support mental health at your institution, that itself is a really great beginning. And when you're in the clinic thinking about how you can make a difference and what you would do, and then coming to a meeting of the AMA and writing that idea down as a resolution and bringing it before a national audience, these are the kinds of ways that you feel empowered and learn how to kind of develop some of the skills that really help as a government relations advocate and advocacy fellow. So, and I'm more than happy to be a resource as well. And honestly, being a leader at your local level in National Advocacy Week, where you actually get to address key issues in our packet that we've outlined comprehensively. Again, firearm violence, GME slots, and the physician shortage that is a similar issue, and prescription drug pricing. If you take that on at your school, that's one of the best starts you can have, especially in being somebody who your classmates can come to for key information. And then the last thing, that was asked is, how has the graph position enhanced my med school experience? And I think that it's been really empowering because you see in the clinic sometimes these cases where doctors don't have enough time with their patients, or patients don't have the ability to actually access the care that they need in follow up, and they end up back in the hospital, and you see people with language barriers that don't get the best care that they can, and all kinds of different issues that can be can kind of bum you out when you're in medical school, and even when you're in your first 2 years and you're studying really hard, and you're let's say on your first day of medical school saying, heck yeah, in 4 years I'm about to be somebody who's out there helping patients. But when you're studying glycolysis, and when you're studying about like the anatomy of the thigh, those things can feel a little bit distant. And being able to engage in this area can be really empowering. And then when you head out into the clinic and you see issues, you have this ability now to be able to take those things forward. When you hear a doctor complain about like how the EHR is not doing any favors for their patient care, you can talk to people at the AMA about what we can do about that and what we are doing about that. And it takes away this feeling that you are disempowered and you're a kind of a cog in the machine of this massive healthcare system that you can't do anything about, even if that action that you could take would help patients. And it empowers you to be that person who actually leads the charge in making these things happen. And it doesn't have to be you spending 50 hours a week working. It can be you working with people around the country on a resolution idea, getting it passed in a weekend, and then having the staff who are right here again, who are so talented and passionate about making your ideas based on evidence reality. They're gonna carry it forward, and that's the power of this organization. So I again want to thank you all so much for tuning in and being curious about what the Government Relations and Advocacy Fellow position is, and what I do, and how we take action on these various issues, and how the different kind of experts who are in DC are able to leverage expertise from all of the physicians, medical students, and residents in the country to take action, and how we're able to push your ideas forward, because it's so important. Because if physicians aren't at the table, if medical students aren't at the table, then everybody else still is, and our voices aren't heard, and our voices, where we have this special trust that patients put in us, that's not going to be at the table either. And some of these people who are our patients don't have the same privilege that we have to be advocating and to have the time to come to these meetings. So let's do our best to make sure that we're fighting these good fights. So thank you all so much for your time. It was really nice to talk to you all, and I hope that we can interact in the future more. And I really appreciate the opportunity. And feel free to reach out about National Advocacy Week as well. Remember, #MSS Advocacy Week. All right, looking forward to working with you all. Thanks.